Yeah, for those that have joined, can everyone hear me, see me? Okay, my name's David. I'm just waiting for a few minutes, a minute or so for the start time. Just a few other people to join who might be trying to click in. So I'm just checking that everyone can hear and can see me. Okay. We might kick things off. Everyone, my name's David Stephensen. I'm a physiotherapist from the UK. I work in a couple of haemophilia centres in the UK. I work in a haemophilia centre in Canterbury and a haemophilia centre in London, at the Royal London Hospital. And I've been working with patients with haemophilia for more than 25 years. So both children and adults. And so welcome to the, what we're calling the Super 6 Challenge for haemophilia. So in collaboration with the EHC and the EAHAD, European Association for Haemophilia and Allied Disorders, Physio Committee, we want to run a series of sort of exercise sessions, 30-minute sessions over the next few months to give people with haemophilia an opportunity to do some exercises at home and improve their sort of health and joint function. So it's a real sort of opportunity to show that exercise and physical activity can be really helpful for people with haemophilia. So exercise is really important because it's been shown to help reduce pain, so it increases muscle strength, we can improve our range of motion in our joints and just our ability to do the activities we like. And regular exercise has also other health benefits. It can reduce your risk of other conditions and even help improve your mood and your sleep. So exercise is really good for us, just for our general health, but also for our joints and muscles that are affected by having haemophilia. So each of these classes will be delivered by a physiotherapist, a member of the EAHAD committee, and we're going to focus on sort of the three main target joints, which is the ankle, the knee and the elbow. And today we're going to focus on just the ankle. So before we get started, I'm just going to run through a few facts about the ankle that you might not know, and just some information for you. So the ankle is made up of 26 bones, and there's 33 joints in the foot and ankle, 19 muscles in the foot and ankle, and sort of each of those muscles are attached to a tendon, which attached to a bone. So almost 25% of all the bones in the body are in the foot and ankle. And here I've got a little example here. We can see a foot and ankle. I'll just point out to you a few main things. So we have the leg goes up here. So we have the tibia, the fibula, and they join together down the bottom at the front of the ankle, and they meet the foot at a bone called the talus. And underneath the talus, the separate bone altogether, is our heel bone. And that's really sort of what we're going to sort of concentrate on today. Then we have some other bones in our foot and then down to our toes. So these two joints in the back of our foot here are what we call the ankle sort of joint. So the main ankle joint is where the leg meets the foot, and then we have another joint underneath that. It's sometimes called the subtalar joint. So sub underneath the talus, and this is the talus. And what's unique about this is that this middle bone in your foot has no muscles that are attached to it. So all the muscles that come from the foot down to the leg cross this area, and none of that actually attach this. That's really important because this is one of the bones that gets damaged in arthritis, and it's important that all the joints in this foot are coordinated, and the muscles help us do that. And because this joint, this bone, is only controlled by some of the muscles and the movements of the other joints, a lot of people call the ankle joint a hinge joint, but actually that's a very oversimplification of it. It's a lot more complex than a simple sort of hinge joint. And unfortunately, it's one of the main joints that seems to be most problematic in people with haemophilia nowadays. This sort of seems to be the most joint that people bleed into, and a problem that most get arthritis in as well, and gives them lots of problems. And we don't really know why that is, apart from it may be due to the fact where people are more active these days than they were previously, but also this layer of smooth bone on the talus is much, much thinner than the other joint, which is the knee joint, which used to be sort of the main problem. And it's much thinner. And so very little wearing away of that sort of thin area in the bone, inside the joint, can cause sort of more problems. So I think that may be sort of part of the reason as well. So very important now, foot and ankle. When we walk around, there's two main things. It helps us, has to be flexible to adjust to different surfaces we walk on, but also has to be very stable to take our weight, and also for when we sort of push off and walk, it needs to be a real sort of stable surface. It has lots of functions. So the muscles around the foot and ankle are really important to control those mechanisms. So enough information, enough little facts about that. Let's go on and try and do some of the exercises that we're going to show you today. Now, we called it the Super 6 because we're just going to simply show you 6 exercises or possible exercises that you could do. There are loads of exercises we could do, and I think exercise is individual for each patient, and I sort of recommend that you would make contact with your haemophilia physiotherapist, or ask to see a physiotherapist linked to your haemophilia centre to get some more specific advice. But the exercises we show you today are simple, and hopefully everyone can do them, and I'll show you some varieties and different progressions of those exercises if you find them a bit easier. The exercise can be done in sitting or standing. It's important that if you do them in standing, that if you're a bit unsure of your balance, you have a sort of a table or a chair or something, or a wall you can lean on just in case you lose your balance. The exercises shouldn't be painful. They might be uncomfortable, but they shouldn't be painful. So if they cause you any pain, you should stop doing them, have a rest, and if the pain goes away, try the exercise again, but perhaps with a little bit less movement, or some of the little less effort, or the number of times that we get you to do it. So if the pain returns as soon as you do the exercise again, I just want you to stop and wait till the sort of next exercise we get to. So again, it's important that the exercise shouldn't be painful. It might be uncomfortable, might cause you a bit of discomfort, but that should sort of stop instantly you stop doing the exercise. And finally, if you've had a bleed into your ankle in the last week, I'd recommend that you don't do most of the exercises because you may cause a re-bleed into your joint, and we don't want to cause that. But so what I advise you to do is watch these exercises, and they'll be recorded, I believe, and you can show them back later, and you can try them later on or in a few weeks' time when your ankle or bleed has settled down. Right, so what we're going to do is now I'm going to just move over to our sort of exercise area that you can see. So I'll just lower our sort of camera down. Okay, so hopefully you'll all still hear me. And so we're going to go through just a little bit of a warm up first, just before to get our sort of ankles sort of warmed up. So now, as I said, we can do these in sitting or standing. And so it's just simply just coming up and down onto your toes. And you can do 1 foot at a time. And if you want to do this in standing, again, we can just 1, 2. It's almost like sort of walking on the spot. Okay. So again, just slowly loosen up the sort of muscles in your sort of joint. While we're sort of doing this, I'll just give everyone a bit of time to sort of just get themselves comfortable, get into an area we have a little bit of space. Just a few minutes just to sort of loosen up, warm up those muscles and joints before we do a little bit of exercise. So just walking on the spot, again, you can do this in sitting and standing. Try to clear your foot each time, again. Okay, well, now we'll just move slowly on to just increasing the movement in our joints. So just doing some range of motion exercise. Again, if you're in standing, we can just up, down, and up, down, and up onto your toes, raise your heel off the ground. That's it. and just go from one leg to the other. Just go as far as you can. Some people may find if you feel a pinching pain in your ankle, just sort of stop short to where you feel that and stop and then go back down. So just go, increase the movement that your sort of joint allows. Okay, so that's in standing for those in standing. Those that are doing sitting is exactly the same thing. One leg then the other. Okay, this time we're going to move our sort of joint the other way, and we're going to keep our heel on the ground and lift our toes up. And we just do one foot and the other. Again, people may find this a little bit uncomfortable, and that's sort of move your legs out in front of you a little bit further and try from that position there. So legs more out in front, and you'll find you'll get a little bit more movement that way because it's taking some of the stretch off the muscles at the back. If you feel any pinching down the front, which sometimes can be caused with hemophiliac arthritis, just again go to the point you feel that discomfort and then stop and then return back to the start. If you're in standing, again, we can 1, 2, 1, 2, 1. You may need to sort of balance on something if you need to sort of hold your balance. It's a bit easier in sitting, this one. Okay, so this time we're just going to combine those two movements. So as before, we pointed our foot, okay? So we're going to point as far as we can, toes down, and then up. Down, and then up, and then the other foot. Down, point the toes, pull them up, point the toes, pull them up. Point the toes, pull them up. And in this position, if you're in standing, we can just simply go 1, 2, 1, 2, 1 foot then the other. So it's onto our toes and walk back onto our heel. Okay. So that's the first two main movements, forward and backwards in the ankle. So this time we're now going to move and do this in sitting. We'll point our toes down, so our legs out in front of us, and we're going to lift our toes to the outside, up and out. So we can see our toes go up and out. What I don't want you to do is twist your leg in your hip and your knee so that they turn out. So keep your knee and the front of your leg pointing the same direction, and it's just moving your foot and toes up and out. Okay, so we're going to do 10 of those movements on each foot. Okay, so this, and the final movement we're going to do is in sort of part of us of just getting everything sort of well and loosened up, is the opposite to that movement. So we're going to lift our toes in and out, in and up. Sorry. So you see that movement there? So last time we went up and out, this time we're going in. Okay, this time I want you to go in and down. In, down. You're almost sort of trying to be resting on your heel, trying to sort of flatten your foot onto the floor. Okay, so on both sides. Okay, so we're going to do 10 again on each side. Down and in. Down and in. So you're almost trying to get your big toe onto the floor. So the inside of your big toe onto the floor. Try not to try and limit the amount of movement at your hips. I'm swiveling a bit because I'm on a wheelie sort of base chair. If I'm on a flat chair, we don't want to really see any movement of your hips on your trunk moving. I've lost count now, so we're just going to do another 3 more. Okay. How's everyone? I hope everyone's getting on with those exercises okay. So we're now going to move on to some a little bit more sort of strengthening. So that's sort of active movement. So we're using the whole movement of our foot and ankle to do those exercises. So it's increasing the sort of strength in those muscles, but also just loosening those joints up. So now we're going to try and work a little bit more on the strength of the main muscles in our ankle. So the first one we're going to do is to try and increase some of the muscles that sort of at the behind our sort of leg, our sort of calf muscles. Okay. So what we're going to do, if you're sitting, what I want you to do is resting your hand on your knee. I want you to press down with your knee, okay, and try and lift your heel off the ground and push down by stopping with your other hand, with your hand. So push down with your hand on your knee and stop your heel lifting up as you try and lift it. Okay, and we're going to try on the other side. So we're staying on your right side. Try and lift your heel off the ground. Toes stay, but try and stop yourself with your other hand. You're pushing down with this hand onto your knee. Okay, so we're going to try and hold that for 3 seconds each time. So again, try and lift your heel off, then push down with your hand, 1 and 2 and 3. And on the right side, try and lift your heel off and push down with your hand, 1, 2, 3. Okay, and we're going to go back to the left side, try and lift your heel off, push down with your hand. So really we don't want any movement of your ankle. And these exercises are good for trying to, if you have some arthritis or damage in your joint, these exercises can be often useful because it doesn't allow any movement at the joint. They're called isometric exercises. And they will cause some compression of the joint, pulling it together, but because there's no movement, some people found it much more beneficial and less painful. Okay, so we're going to go back to the right side again. So we're going to try and lift our heel off and push down with our hand to stop that heel coming off. 3 and relax. And then back to the left side. So try and lift your heel off, push down through your leg and relax. Okay. And we're going to do 2 more on each leg. And try and lift off again with your heel, push down. Good, on the right side, so we're going back to our left side. Okay, 1, 2, 3. And back to the right side. 1, 2, 3. And back onto the left side. 1, 2, 3. And 1 more on each side. Right side, try and lift off, heel off. 2, 3, and finally on the left side. 1, 2, 3. Okay. The next exercise is again an isometric exercise for our muscles that lift our toes up. So this time we can use our other foot as a resistance this time. So we're going to try and lift our foot off the ground. But if you notice I put my foot on top, I can stop that coming off. So I'm going to try and lift my foot, but I'm using the weight of my other leg to stop that. So again, it's an isometric exercise to try and limit the amount of movement at the joint, but still work those sort of muscles. So we're going to try and do 10 on each foot. And we start with the right foot, so try and lift up, lift your toes up, and relax. And try and lift the toes up again, and relax. So I'm using this other leg to stop that movement, to give that resistance to that. And try and lift your toes up again. And relax. again. And relax. And try and lift your toes up again. And relax. And try and lift the toes up again. Relax. Okay, we've got 2 more to go. Toes up. And relax. And try and lift your toes up again. So we're trying to hold that sort of contraction for about 3 seconds each time. Okay, now we're going to swap feet again. So this time we're going to have our left foot left on the ground. We're going to put our right foot on top, and we're going to try and lift again our foot off the ground, our toes up the ground. Keep our heel down, and try and lift up and down. So you'll probably feel a little bit of the effort will come down the front of your shin. That's the sort of muscle there that's doing all the work. And lift your toes up again and relax. And toes up again and relax. And toes up again and relax. And toes up again. Okay, 3 more of those. Toes up and relax. And toes up and relax. And last one. Toes up and relax. Good. Okay, the next exercise, again, I haven't sort of pre-warned anyone, but it does. Okay. I think my video may have stalled. Don't know if anyone can. Not sure whether anyone can still see me. Can anyone see? On my screen I've lost my visual, but if you can still see me, let me know and I'll continue on. Or if you can still hear me, let me know. Okay, I'll try. Christy, can you still hear me? Okay, if everyone can still see me, I'll keep going on. I can't see myself, so I'm just hoping that you can visualize me. So the other exercise is I'm going to put a towel on the ground. Okay, and this exercise is all about trying to sort of increase some sort of movement and exercises a little bit of resistance for the muscles that sort of turn your foot and ankle in and out. So we're going to start by just trying to drag the heel, drag the towel across, out, underneath the foot, okay, and then we'll straighten, and then we'll go the other way with the left one. We do 5 on each foot, okay, we'll straighten our towel again, and we're going to do 5 5 again on the right foot. Okay, and then 5 again on the left foot. Okay, and then we're going to go the opposite way and try and turn our foot in. So we're back onto the right foot. We're going to try and drag the towel in. 3, 4, 5 on the right foot. And we move to the left foot. Okay, we straighten our towel again. And we're going to repeat that another 2 times on each foot. So again, we're going to drag the towel in under our foot. And we're once more on each foot. Okay, excellent. So the next set of exercises we can do in standing, for those that can do in standing, okay, it's a raising our heel raises, and so we can do that. So double behind, sucking up our toes, lifting our heels off the ground. So I want to do 10 of those. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, so a way you can progress that exercise, for anyone that's finding it quite simple, is we can easily progress that to doing it on one leg. Okay, I'm not sure who's watching and who can do that, but we won't go to get you all to do that, but that's one way that you can progress that exercise. The next exercise that I'm going to get you to do, because a lot of our sort of foot and ankle muscles are also responsible for our balance, and so we're going to do a little sort of few little balance exercises to finish off. So the first balance exercise I want you to do, I just check that the camera can see me, my feet. Okay, you're standing in a heel toe position. So with our left foot behind, at back, put our right foot, our right heel on front of our left toe. Okay, if you need something to sort of stand beside something to keep your balance, but I want to see if you can hold that position for sort of 10 seconds. So keep your weight, try and keep your weight evenly on both feet, and we'll count down now. 4, 5, 6, 7, 8, 9, 10. It's quite difficult to stand in that sort of position. It's called a sort of tandem stance. And we're going to now put our right foot behind and put our left foot in front. So our left heel, our right toes. If you're having quite a lot of difficulty with that, we can just increase our base by moving our foot just to the side, that position there, or we can just sort of step our foot a little bit further forward to increase the amount of our base of support. So, but if you can, try and have the toe touching the heel, and we'll try and repeat that again for another 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, we're going to repeat that. Left foot behind, right foot forward. Okay, get your balance, and we'll do another 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And just swap the feet around again, so your left foot is forward in front. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And we'll repeat that again. Down right foot forward. About 10 seconds. Swap to left again, left foot forward. 1. Good. So you're finding those balance exercises easy, that you can progress those exercises to try and to do some balance on one leg, and so we're not going to do that today. We're running out of time for this sort of session, but have a talk to your physiotherapist with your haemophilia centre, or ask to see someone, and they can progress some of these exercises again to be some standing on, so some single leg balance, to really sort of works the coordination of those sort of muscles around the sort of foot and ankle. Okay, just to finish off, we're going to finish off with one sort of set of exercises to finish with our Super 6 for the day. And this time we're going to be standing, with our legs sort of hip width apart, side by side. And we're going to take a step forward with our right foot and balance for 2 seconds. 1 and 2, and then back again. Okay, we're going to repeat that with our left leg. Step forward, just bending our knee and just letting our weight come over the front of our foot. 2 seconds. 1 and 2. 1 and 2. Okay, we're going to try and do 10 on each leg. We've done 5. Trying to let all our weight onto our front foot if we can, by bending our front leg. And then the final exercise of that sort of group is, instead of stepping forward, we're going to be stepping out to the side. So again, start with our feet level, hip width apart, side by side, and we're going to step out to the right, and let our weight go across our right foot for 2 seconds, and then back. And then the same thing. We point our toes out, and back. And 2. And 2. We've done 5, we're going to repeat that 10 times again. So it's weight onto your front foot, try and get your weight fully onto your front leg. Hold to count to 2 and then back to the start. As much weight as you can on your front leg, and once more on each leg. Good. Okay, so that's wraps up some of those exercises that we can do. I hope you sort of managed to get through some of those and could do some of those. Again, I'm having trouble with my video camera, so I can't see myself. So I'm hoping that you can see me on the screen and hear me. So some of those exercises are easily doable for people with haemophilia, no matter what sort of state their joint is in, but it will improve the muscle strength around your foot and ankle, and improve the stability of the movement and function of that foot and ankle, and increase the movement in as well, which will help you do everyday sort of things and everyday activities better. And it's just it's an introduction, general introduction into some specific exercises that you could do, but your physiotherapist could help you and advise you on further exercises, because exercise really should be individual for each person, and different exercise will be better for different people. So we can't, and one recipe is not sort of good for everyone, particularly when everyone has different sort of needs and everybody has different sort of goals. So I recommend that you speak to your physiotherapist about those. So I hope you found them beneficial, and that there's more that you could do if you're interested. Remember that exercise and movement is good for you, and that the exercise we've done today can be done by everyone. Finally, I recommend that you try and do some form of exercise every day. We've today focused on a little bit of strength and range of motion exercises, but also exercise that gets your heart beating a bit quicker as well. Is very useful, is beneficial for your health, doing that at least sort of 3 times a week. It's good to sort of mix up your sort of form of exercise, from doing some strength work and balance work to also doing some aerobic or cardiovascular work. But your physiotherapist or your haemophilia care team can advise you on that. So we'll be back in a month's time, where we will focus on some exercise specific for the knee joint and give you a bit more information about what the knee joint does and some facts about that. So I hope you enjoyed today, and we will see you in a month's time. Thanks very much, everyone.